So we're going to spend just a little bit of time talking about SVC. There are two different ways that we can get an SVC. I do have a preference. I think one is definitely easier for most patients than the other. However, our device, thankfully, we don't have to tell it which method we're doing. It will automatically know exactly what we're doing, whether we do the IRV method that we're going to talk about first or the ERV method that we'll talk about in a moment. So for the IRV method, the tidal breathing is the same on both methods. So we want this to be relaxed, steady tidal breathing. With the ATS 2019 standards, steady tidal breathing is actually now a part of the standard. So we always need to make sure that we are tidal breathing and encouraging our patients to just have a nice, relaxed, normal, quiet breathing pattern prior to starting the test. And our software will prompt you once that's been established. You do not want to start the maneuver before the device has confirmed that that steady tidal breathing has been established, or else it could cost kicking that test out. All right. If for some reason that steady tidal breathing is not established after 10 breaths, the software will go ahead and prompt you to start the maneuver. All right, so the IRV method, or the inspiratory first method, is exactly like that textbook graphic that we have seen in the previous slides. We're going to tidal breathe. We're going to have the patient take a big, big, deep breath in as far as they can, and then we're going to have them relax and exhale all the way down to their ERV, or to that point of expiratory plateau where no more air is coming out of their lungs. So this is the IRV method. For some patients, this method can be really, really difficult to make it all the way to ERV from their IRV, that top inspiratory. So making it all the way from the tip top all the way down to the bottom, for some patients, especially patients with obstruction, can be really, really difficult. And in those instances, that would be when we would definitely recommend trying to do the ERV method. I am an asthmatic myself. I am a really well-maintained asthmatic, but I actually do have a pretty, a clinically significant difference between my vital capacity when I do the IRV method versus the ERV method. And I will show you both methods here in just a moment. But for the ERV method, or the expiratory first method, again, tidal breathing is exactly the same. It needs to be steady. We need to wait for the device to prompt us to start the maneuver. And then if that hasn't happened within 10 breaths, the software will prompt you to start. With the expiratory first maneuver, it's just as it sounds. After our tidal breathing, we will exhale down to that point of expiratory plateau, all the way down to ERV. And then when prompted, then take our big deep breath in all the way up to TLC. Again, this method does tend to be a little bit easier for most patient populations, and it's not a setting that you need to adjust within your software. It will detect whether you are inhaling first or exhaling first, and the coaching bar will adjust accordingly. A few just quick tips on that SVC test. Again, we want the patients, this is a slow vital capacity. We don't want the patients huffing and puffing on this test. We want it to be a maximal inspiration and expiration at a relatively constant flow. We want to make sure that they can reach both extremes within 5 to 6 seconds. Again, for some obstructive patients, it's going to take them longer to get to that point of expiratory plateau, and we can terminate that at 15 seconds and continue on with the test if it's taking them that long to exhale. All right, again, this is a relaxed maneuver. We really do want to make sure that the patient is not pushing out hard and fast like they would on a traditional FVC, or a forced vital capacity test. Some quick quality checks on the SVC test. We want to make sure that there's no leaks at the mouth or the nose. This has an inspiratory component, so we always want to make sure that our patients are wearing their nose clips. We want to make sure that they're not obstructing the mouthpiece. A lot of people will try to play it like a trumpet, or to put their tongue in the way. We want to make sure that they have a good teeth on top, tongue on bottom seal around the mouthpiece. Again, while this is a relaxed maneuver, we don't want it to be too slow, and we don't want any hesitation either. No glottic closure. Most of the time, glottic closure is all patient posture. So making sure that our patients are sitting up nice and tall during the maneuver, that they're not hunched over, closing off their airway, and chin elevated off the chest. That's just something that we can monitor during the test to help our patients along. All right. So I am going to go ahead and actually swap over so that you guys can see a quick example of the SVC test. So when we perform spirometry on the Pro Lab device, you'll notice that we actually only need the spirometry handle. So we can actually disconnect the motor block for spirometry. You'll see that there's a silver button on one side of your motor block. You can push that, line up the arrows, and then lift the motor block off of the spirometry handle. The holder on the side of your ProLab device is magnetized, so your motor block should stay in place while you do testing. All right, just like with any other of our tests, we do have an arrow on the top of the spirette and an arrow that you see I have marked on my ProLab. Those arrows, when we insert the spirette, are going to line up. If we happen to get the spirette in incorrectly, the device will prompt us that we have a spirette insertion error. So always just make sure those arrows are lined up. Now, for this purpose today, I will be using the traditional spirette. We do have an inline filter solution for the Pro and Pro Lab that is the Pro Filter Kit. That is the only approved filter solution for this device. And it is a modified spirette with a forward-facing filter. And so it looks like this. And there's actually a setting in the software to adjust and let the device know that we would be using a filter for testing. So again, if you're using the Pro Filter Kit, again, you would still line up your spirette FA arrow to arrow, push it all the way in, and then the filter is on the patient side. And again, the Pro Filter Kit should be used for all tests on the Pro and Pro Lab device. All right, so you would either be using this modified spirette or the traditional spirette for testing. All right, so again, for the SVC test, we only need the spirometry handle. I already have myself selected as a patient here in my software. Because of the webinar format, I am using the EasyOne PC software. I'm not casting from my Pro device. So when that filter message pops up, it will be a little bit different than what you will see on the Pro Lab. On the Pro Lab, you will see a picture of the Pro Filter Kit. In this example, you will see the solution for the PC device because of where I'm sharing my screen. So I already have myself entered as a patient on the device. So I'm going to go ahead and click on Test and then click on SVC. Right? Because there's an inspiratory component, it is going to ask us to enter or confirm those environmental settings. So I'm going to go ahead and click Confirm. All right. And again, remember on your Pro Lab device, it will have a picture of the appropriate filter for that device. Before every spirometry test on our devices, you will be prompted to block that mouthpiece before starting the test. You can either use the plastic on the front of the mouthpiece or a gloved hand to the back, just so that there's no flow moving through that point-to-point ultrasound sensor for this baseline setting. So I'm going to block the mouthpiece with my hand and click OK. And then once that baseline setting is established, you'll see that the coaching bar has turned blue and is telling me to start the test. So I'm going to do the IRV method first, or the inspiratory method, inspiratory first method first. So starting with normal breathing. Watch that coaching bar. It will tell me when to start the test. Awesome. So as you can see, I did the inspiratory maneuver first. The software gave me that instruction to take the big deep breath in and then to exhale fully down to that point of expiratory plateau. Right now, you'll see my session quality grade is only a D because I only have one test. SVC plays by the same spirometry rules as our FVL and FVC tests. We have to have a minimum of 3 acceptable, reproducible trials for the session to be complete. I'm going to go ahead and demonstrate the ERV method next. where I do the exhalation first. So again, just pay attention to those coaching bars. Awesome. So our device really does try to help coach you through the maneuver. So right now it's telling me on my next attempt to get to my 3 reproducible trials to make sure I'm taking a deeper breath. Like I said before, I really do have a significant difference in my VC between doing the IRV method and the ERV method. And that is why it's telling me if I want to complete this session, I need to do it just like I just did it. Because if you look down here on my results, my vital capacity between my first and second session, it's a pretty significant difference between 4.3 to 4.5. So again, it's telling me to take a deeper breath on this third maneuver just so that I have that repeatability. All right, but you can see that the software does automatically change the coaching, whichever method you decide to do, and whichever is easiest for you to coach and teach your patients to get the best results. All right. For time's sake, and because we want to spend more time in multiple breath washout, I'm not going to complete my SVC session, but I'm going to go ahead and click on test to go back out to our test menu. Again, we would want to do our 3 acceptable reproducible trials, session quality being an A or a B grade, and making sure that the software has told us that the session is complete.